Right. Hello and welcome to the California 2030 Final Report Recommendation and Next Steps webinar. Next slide, please. First, we're going to cover some housekeeping items for today. Closed captioning and ASL are available. You can access these by clicking the icons at the bottom of your screen. Participants will be muted during today's presentations. Questions may be submitted during the webinar in the Q&A box, or you can wait and ask them during the Q&A segment near the end of today's agenda. This webinar is being recorded, and the presentation recording and transcript will be available on CDA's YouTube channel and the California 2030 webpage. Next slide, please. All right, today you'll hear from a variety of leaders from across California who represent the state, local area agencies on aging, our counties, and independent living centers. You'll also hear an overview of key takeaways from the California 2030 Final Recommendation Report. And we'll close with time for questions and comments. I will now turn it over to California Health and Human Service Undersecretary, Marco Meach. Marco?
Nelson, thank you so much. And to all of you who are joining us today, we are very grateful for your time today as we kind of begin to talk about the recommendations that have been put forward as part of the CA 2030 plan. Before I kind of jump in, I do want to express my gratitude and thanks first and foremost to Susan Damaris and the entire team at the Department of Aging for really getting deep into the community and engaging with each of you. I also want to thank all of the individuals who were part of this process over multiple years, but in particularly this last year in digging deep to help us understand how we continue to build an age-friendly state. And so I am really proud where we are today. And on behalf of Secretary Galley and all of us at the Health and Human Services Agency, I think this is a continuation of the important work that we are doing collectively as part of the master plan for aging. And so I think we are positioned well to move into kind of the action mode over the course of the next couple of years. And I'm really excited for the conversation that we are about to embark on as we review all of the different components of these recommendations that are being put forward. The governor's master plan is clear that our state needs to prepare for 2030 when 1 in 4 Californians will be age 60 or older. And in just over a decade, we'll have about 2 million Californians who are going to be 75 years and older living in our state. And this is a tremendous progress, and this is an exciting journey that we're along. And although, to some, this may be an overwhelming situation, this is just such an important piece as people have the opportunity to age in place in a way that is dignifying. And the population has shifted, particularly in certain parts of the state. We know that in the Inland Empire, the Central Valley, and here even in Sacramento, the projected growth is going to be pretty significant. And so we at the Health and Human Services Agency, not only within the Department of Aging, but across the various departments that we are responsible for, are really beginning to think about how we stitch together our programs and services in a much more holistic way to serve older Californians so that they can continue to live in the communities of their choice with dignity and respect. What we see today is truly kind of a system that is fragmented and fractured. We know based on recent studies that older adult homelessness is on a rise. The effects of climate change and disaster preparedness are important things for us to continue to consider. And families are exhausting their limited financial resources when it comes to providing support to their older family and loved ones. We also know that there is a pretty significant gap with regards to caregivers and their ability to continue to provide support. And we have a worker shortage that is an important thing as we think about moving forward and continuing to provide high quality care and services to individuals who are older in California. As we highlighted in our 2024-25 program priorities document that we released earlier this month, it really is time to put all the pieces in place for an aging network that performs more like a true system of care and services. And most importantly, that achieves the administration's goals of equity. Equity for all who are served, no matter where they live, and equity for individuals and communities that have been marginalized. We are ultimately anchoring this work in equity because we know that there are many individuals who are perhaps in that forgotten middle, as well as individuals who are low income, who are having to navigate the complexities of being able to age in place. And so it is important for us to anchor this work in equity in a very deliberate way. We did that with the master plan for aging, and we do intend to do that here as well. And I'm really excited about all of the individuals who are part of the conversation to continue to enable our ability to really anchor this in equity. Our federal partners also are looking at ways in which we serve people with the greatest economic and social needs through our area agencies on aging. And I think it's really important to both acknowledge and thank our area agencies on aging for their tremendous leadership and work over the past many decades as they both implemented the programs pursuant to the Older Americans Act, as well as the work that we've undertaken as part of the Older Californians Act. However, to do our work collectively and to deliver on a true system, and to do that effectively and equitably, we do need to more intentionally align our local programs and services. So whether that's kind of our work around CalFresh or older adult protective services, or whether that's around our work around CalAIM or behavioral health modernizations, it's really incumbent on us to streamline the wide array of services older adults and their families rely on each and every day. And we're building a no wrong door model with our aging and disability resource connections as kind of a centerpiece. Strong area agencies on aging are essential to this structure. They are kind of the core to our belief in how we deliver these programs and services. And my hope is that today's webinar, we have the ability to create the space to talk through the pieces of a streamlined network more closely aligned with these various other systems and reforms that we're looking to leverage across our organization. As the secretary often tells us, we cannot look at these pieces or this work in silos or independent of each other. They are disparate efforts that are siloed, but it's our responsibility and duty to really begin to connect the dots and build the puzzle pieces together so that from a person perspective, from a family perspective, from a caregiver perspective, these are seamless entry points that enable us to ensure that people get the appropriate services and the care they need without having to go through the various bureaucratic structures. So later this week, our federal partners are expected to release the final rule on the Older Americans Act and the Administration for Community Living's first substantive changes to that structure in several decades. And we in California are poised to do the same in close collaboration, obviously, with our local and federal partners to strengthen the aging network for generations to come. So as we kind of further engage in today's conversation related to the CA2030 recommendations, I hope that we really come to this conversation with an open mind and with the idea that we're really looking to serve the individuals that are in our communities. This year marks 50 years of the Department of Aging, and over the course of the next couple of weeks, the Department of Aging will be profiling older adults that we are serving. I would encourage you to visit the aging.ca.gov website and to see the profiles of the individuals that we serve. Fundamentally, this isn't about system change, although it is fundamentally about the people we're looking to serve. And the stories that you will see over the course of the next couple of days to celebrate the 50 years of the Department of Aging are anchored in real life stories about people's experiences in different parts of the states with different background, different cultural experience, different language access needs. And so as we begin this conversation, it sometimes can be overwhelming to think about the system. I would encourage each of you to come to this conversation really anchored in the individual stories that we all have ourselves, but also the stories that we're looking to highlight as we celebrate 50 years with the Department of Aging. So on behalf of Secretary Galley and all of us at the Health and Human Services Agency, I do want to extend a heartfelt thanks and gratitude to our local partners and stakeholders, and also the Department of Aging for embarking on this important conversation as we begin to reimagine what an aging network in California is. So Susan and the rest of the team, thank you for having me, and I look forward to continuing to learn and hear the conversation today.
Marco, thank you so much for joining us this morning, and thank you and Secretary Galley for being terrific thought partners over the past year with each stage of this California 2030 work. We've brought it to you. You've asked great questions and encouraged us in our work. And today we hear that encouragement as we move ahead with our stakeholder community and our sister departments that have a keen interest in this work as well. As together, we serve the very individuals that you just spoke of, who cross over Department of Healthcare Services and Social Services and other departments in our state and federal government. So thank you so much for your time today. We appreciate you joining us and for your tremendous support of this work. More to come. And now it is my pleasure to introduce one of many stakeholders who will be sharing their perspectives with us today. I want to echo Marco's thanks for all the members of our California 2030 Steering Committee, as well as our partner in the work, Collaborative Consulting, who did tremendous work with the department and our stakeholders. So it's now my pleasure to introduce you to our first stakeholder. We'll be hearing now from Victoria Jump from the Ventura County Area Agency on Aging. Welcome, Victoria.
Good morning, and thank you for the invitation to provide remarks. On behalf of the California Association of Area Agencies on Aging, I want to thank the department and other organizations involved in developing the California 2030 plan. As C4A, our state association, we felt included and heard as partners in the process and in developing the recommendations. C4A was also represented on the committee by Michael Costa, Annalisa Dale Pinal, and Pam Miller, and representation included rural and urban AAAs, county-based AAA, nonprofit, and JPAs. As far as the plan, these are not new thoughts, and many of the challenges that we've had as AAAs have led to these recommendations. The plan and the related objectives really will be our chance to fix things, and will provide a strong foundation for the future when more than 30% of the state population will be over the age of 60. You see pictures at the top of the slide of people, and I'd like to talk about Walter and to center the webinar around the pictures of these people and underscore why the plan is so important. And if fully funded and realized, will be transformative to the lives of the people we serve every day as area agencies on aging. Walter is a 60-year-old Black man who enjoys walking his dog, socializing with his friends, and playing chess in the park when he is able. He has limited work experience and attributed to some behavioral health challenges that he prefers to keep private. He has no children and a strange relationship with his brother. He's experienced homelessness and deteriorating health. He needs housing, food, pet food, clothing, bedding, and basic necessities. As he ages, his mindset is becoming more and more negative. He worries about his situation and doesn't really think it's going to turn around. He has received assistance, but he's never been connected with his local area agency on aging and doesn't even know what an area agency on aging is. He wants to have a better relationship with his brother and a nice place to live. This ambitious plan, California 2030, is needed for Walter and the thousands of other people like him in the state that struggle daily that are not connected to resources. It's our chance as an aging network and as area agencies on aging to do better and to do what is needed. So on behalf of C4A, thank you to CDA for this collaborative and inclusive process. We look forward to working with you and partnering with you on implementing the recommendations. Thank you.
Great. Thank you, Victoria. Next, I'm going to introduce Jacob Bilecki from Collaborative Consulting to discuss the final recommendation report. Jacob?
Thank you very much, and good morning, everyone. I'm excited to share with you the sort of results of the California 2030 project, and also share with you a bit of the process that we took over the course of a year to arrive at the final recommendations. But first, I wanted to just share with you the goal of California 2030, which was to define a future-ready California aging network with actionable recommendations. Next slide. What I'll first do is just outline the phases of work. I know many of you have tuned in to our prior webinars where we shared the results of parts of our research. Again, we're excited to share with you the full results and synthesis of our research. California 2030 consisted of 9 phases of work over the course of 13 months. We published the report just a few weeks ago, and a lot of this work was involved deep amounts of research, both interviews and focus groups, primary research and secondary research as well, where we looked at the population and demographics of the state of California. So the context of this is really the California Aging Network. So how we define that in this project, next slide, please, is the California Department of Aging and the 33 area agencies on aging. And so we refer to the California Aging Network many times in this project, and that is sort of our point of reference. Knowing that there are many stakeholders involved in sort of the broader picture of the work of CDA and the 33 AAAs. However, a lot of this work and a lot of the recommendations relate directly to the work of CDA and the AAAs. Next slide. So Susan had mentioned the steering committee that was sort of part of the backbone of this project. These are the 11 members of the steering committee. They really represent sort of the institutional stakeholders of the California Aging Network. And sort of the diversity of the network. The steering committee met on a monthly basis, in most cases in person in Sacramento, to review the research, to work on the findings of the research and interpret those findings into a vision and actionable recommendations, which led to the final output and outcome of this project. Next slide. As Victoria mentioned, we were also guided by personas, by a series of individuals that represented the diversity of older Californians. And these folks were sort of always in the wing in the work that we were doing. We actually had printed cards of their faces in the room as we were working. And so each one has their own story and their own lived experience that we referred to and used to guide a lot of the work of the California 2030 project. Next slide. So first, I want to outline the research phases of work, and then I'll share with you some of the results. And then finally, we'll spend most of our time presenting on the key traits of a future-ready network and of the final recommendations. So our research involved a significant amount of stakeholder engagement, which largely took the form of interviews, of one-on-one interviews and small group interviews with a variety of external stakeholders. We met with each area agency on aging across the entire state, in some cases in person, and in other cases remotely. We met with directors and staff of those AAAs. We also captured over 17,000 voices of older Californians through the Community Assessment Survey of Older Adults. And we also studied trends and projections around population, demographics, the nature of the aging network. We pulled a lot of data about the area agencies on aging. We surveyed the area agencies on aging around funding, priorities, efficiencies, and we also studied promising practices in other states. What have other states done? What are other states doing to ready themselves for a different future and to design or redesign solutions to improve the processes and outcomes of their aging networks. So all in all, we have almost 20,000 voices that have informed this project. Next slide. And some of our findings from our external research. So these are sort of the conditions and things that are happening immediately outside of the network, outside of the California Aging Network. We're seeing an increase in need and demand for services. We're seeing increasing diversity of Californians. We're seeing widening social and economic disparities. We're seeing the integration of systems across healthcare, social services, behavioral health. We're seeing new technologies being deployed inside of those systems. We're also seeing consumers and individuals utilizing technology in new and different ways, and expecting services to be delivered in new and different ways through new technologies. We're seeing different trends around health versus social services spending at the local, the state and federal levels as well, where there's been a surge in healthcare spending that looks very different maybe than a lot of social services spending. We're seeing an increase in healthcare partnerships, both between healthcare organizations, be it health plans or hospitals, health systems, and traditional community-based organizations and social services organizations. We're also seeing increases in fee-based services and competition in this sort of space of social services and community-based services. And we're also seeing increases in public emergencies and natural disasters. These are just some of the big sort of conditions that not only we find ourselves in, but that we're anticipating in the future. Again, thinking about California 2030. And some of this data that we're sharing here is some data from the CASOA survey that just demonstrates really some of these increasing diversity and widening social and economic disparities in the context of food and nutrition. Next slide, please. Now, we also looked internally inside of the California Aging Network. Of course, that was a major objective of this project. And what we found was, to sort of echo what we heard from Marco, high degrees of variation, in terms of funding and capacities across the 33 area agencies on aging, different approaches to strategic planning and research to inform where and how AAAs are prioritizing services or spending their money, the differences in the types of services and programs that are being delivered at the local level, the sort of absence of quality measures of performance evaluation and assessment, and variation in partnerships, collaboration, and integration. So these are sort of maybe the networks at the local level that AAAs may or may not build, sustain, and lead. We also see some limitations around data and opportunities to improve the quality of data that's being captured and utilized to measure and demonstrate the efficacy of the work of the California Aging Network. So things like consumer demographics, outcomes of services and programs, spending within each county, so spending sort of state and federal dollars within each county, and also the opportunities to build and strengthen more robust data management systems at sort of a network level. And then we also see in here, there's limited public awareness about AAAs and the California Aging Network. And this bar chart just sort of it demonstrates the variety of AAAs in terms of the types of funding that they receive, or the share of types of funding, local, state, and federal. And so this is maybe just one representation of that variation or diversity. Next slide. So we worked with the steering committee and with CDA on bringing all of this research together and identifying what are the critical sort of visionary traits or characteristics of a future-ready California aging network. And we came up with 8 key traits that define or describe the ideal future-ready aging network. And this was used to guide the rest of this project. It was used to guide and inform the recommendations that we'll get to in just a moment. And so I want to briefly introduce these 8 traits before we introduce the recommendations. So the first trait is aging and disability forward, which means that a future-ready network, it understands, prevents, and combats negative stereotypes associated with aging and disability. The next trait is inclusive and equitable. And it's a future-ready aging network that addresses ageism, ableism, racism, implicit biases, and it manages the resources and programs in the most inclusive and equitable ways. The next trait is well-known and accessible. It's visible, it's recognized, it's accessible to all Californians. The fourth trait is it's consistent. It provides reliable, standard quality and core services across the entire state. There's a level of consistency, but it's also locally responsive. The fifth trait, it adapts and develops services, practices, and programs to address community-specific needs and opportunities. And this is sort of in the DNA of the national and state aging networks. And so in addition to strengthening the consistency at a state level, there's still obviously a tremendous need to remain and strengthen its local responsiveness. The next trait is it's strategic and action-oriented. It leans into strategy. It invests in and relies on the leaders within the network who can anticipate and respond to internal and external opportunities and threats. The next trait is it's performance-based and it's outcomes-driven. So it demonstrates the value and the impact of its programs and services. It measures and monitors performance and demonstrates the outcomes of its results and investments. And finally, it's integrated. A future-ready aging network is connected. It's connected to local, regional, maybe state-level, public and private stakeholders, spanning the continuums of services and resources that its consumers rely upon: human services, healthcare, behavioral health. And it serves as the trusted aging services resource, advocate, and ally. So these 8 traits really sort of paint the visionary picture of what this future-ready aging network is. And that really kind of sets the stage for the recommendations. So next slide, please. So this is sort of the final phase of work from the project, and I just wanted to mention the methodology. So we had worked with the steering committee and with CDA for several months on hundreds of action items, basically opportunities to bring forward action that aligns with those traits, but and also can again drive and ready the aging network for the future. And so we worked intensively with the steering committee and with CDA on refining those recommendations into something that was sort of distilled and more manageable. And ideally, these recommendations, the audience for these recommendations are primarily the Department of Aging and the 33 area agencies on aging. And the recommendations really span different types of action, from sort of small practice or behavior change to maybe major structural changes across the network. So with that, I will introduce the recommendations. Next slide. So there are 9 categories that we arrived at of recommendations. And what I'll do is I'll introduce these as sort of a high level. I'll read a goal statement for each one. And then I will invite you to read the report. Each recommendation, each item does have a description. So there's much more detail in the final report that you do have access to. So the first area is around strategic planning. And the 2030 goal statement for strategic planning is that the California Aging Network is on the front line of a historical demographic shift, and it's well prepared to address older Californians' current and emerging needs. So it's anticipating the future, and it recognizes that maybe the future doesn't quite look the same as the past. And so this happens both by understanding itself, so understanding the AAAs and CDA structurally, systematically or systemically, but it also has a better understanding of the people it's serving and of the communities and the diversity of communities that are being served. So strategic planning is sort of the first recommendation area. The next one is around funding. And in funding, the California network leverages sustainable funding from traditional and non-traditional sources to meet increasing demand and complexities. It both sort of spends money better, but it also works to draw in additional financial resources in sort of traditional ways and non-traditional ways. Maybe some of those non-traditional ways that we feature in this report are things like healthcare contracting. So obviously, working in within the Medi-Cal environment, but also private pay services, the opportunities for area agencies on aging to offer sliding scale private pay services to consumers that may be more affluent or well off. The next area is in services. And the goal statement for the services recommendations are the California Aging Network services. They're easy to access and they meet the evolving needs of Californians. And so this, in a way, it tries to sort of tighten and better define a series of services that can be available to all Californians. This was a major sort of a point in what we heard and learned from our research was the need for some services to be universally available across the entire state and for there to be sort of a minimum quality standard of those services. And what we heard most was around resource navigation, information and assistance, and the aging and disability resource connection as a sort of a key driver for that. But we also heard there being a need for more sort of integration and partnerships around housing, financial planning, health and wellness services, caregiving services, and transportation services. And we also heard of, an opportunity to explore, more types of vendors or shared vendors. So the expansion of regional and statewide vendors. These are organizations and companies that work sort of under contract with area agencies on aging. The fourth recommendation area is in communications. And the goal statement is Californians are increasingly aware of public and private aging resources. And in the California 2030, we envision, that the California Aging Network is really, helping to lead the charge on communicating the availability of resources, both inside of the network and kind of affiliated to the network and beyond the network. So different types of recommendations that came out of this was areas of common branding and marketing, of building the capacities and the capabilities for strengthening communications at the local level and at the state level, providing resources to customize local communications to ensure that communications are responsive and accessible to all consumers and prospective consumers. And the development of awareness campaigns, strengthening emergency communications, and also ensuring that aging and disabilities is responsively incorporated into communications, and that there are efforts to also reframe and combat negative stereotypes. The fifth recommendation area is around planning and service areas, or PSAs, and designations. And the goal statement here is that older adults, people with disabilities, and family caregivers in greatest economic and social need have access to a AAA and AAA services, excuse me. And so what this involves is, reviewing and potentially updating areas, sort of structural areas to the California Aging Network, including the boundaries, the geographic boundaries of the network, the designations. So these are really the standards for operating a AAA. So what are sort of the requirements for operating an area agency on aging of the future? And ensuring that new requirements are reflected in the right places, either in designation applications or potentially in new contracts, and that there's adequate support for any changes that might be made in this area. The sixth recommendation is around performance, and the goal statement here is that the California Aging Network is high performing across administrative and programmatic activities. And the objectives to reach this are through sort of a variety of ways, including, the sort of strengthening evaluation, performance evaluation, setting and determining statewide performance standards, understanding how well the aging network is actually targeting those that have the highest social and economic need in their communities, setting performance expectations, providing support and assistance for those that may not meet certain performance standards, local and statewide reporting on performance, and also, on the operational and administrative side, ensuring that policies and procedures are efficient, and that the AAAs have the adequate sort of support and guidance to meet performance expectations. The seventh area is around data and information technology. The goal statement for 2030 is that data and IT systems, tools, processes, and governance help drive administrative efficiencies and enhance service reach and delivery. And so this area of recommendation really involves things that are happening behind the scenes to basically improve, again, the administrative load and efficiencies of area agencies on aging, and also improving how consumers might be able to access, navigate resources and services in the future. The eighth area involves workforce. The 2030 goal statement here is that the workforce of the California Aging Network provides high quality, culturally and linguistically responsive services. And so part of this might involve ensuring that AAAs have sort of the minimum staffing needed and required to be able to fulfill goals and objectives of a future-ready California Aging Network. So it might involve setting minimum staffing roles, ensuring that each agency has the necessary expertise or roles and functions to meet the needs and goals of a future-ready aging network. That AAAs also reflect their local communities and the people they're serving. There may be shared support and assistance across multiple AAAs or across the entire network, either in terms of certain functions or in this case, this recommendation, it's a universal development officer, so the opportunity for somebody to help build capacities at scale. There are sort of tools and support to help newcomers to the network get oriented to the work of the network and the history of the network. There are increased resources for leaders and for staff to onboard, to train, and to be as successful as they can in their work through peer mentoring and support, education, training, etc. So a lot of this has to deal both with sort of strengthening the existing workforce, but also leading into building kind of the workforce for the future, and ideally attracting new workers into the field as well. And the last area is advocacy. And the goal statement in this area is that the California Aging Network leverages its expertise and reputation to draw ongoing attention to the needs of future Californians and investments in a future-ready California aging network. And so this really sort of combines work that's already been happening, particularly around the master plan for aging and a strategy to continue that work beyond the current administration, and ideally to sort of ground a master plan on aging into kind of the future of the state of California, so that that focus may ideally never go away. It just evolves, it changes. That there is sort of greater public awareness, not only about the lived experiences of older Californians, but also about the existence of the network and its own needs for, let's say, resources in the future. And there's efforts to organize communities focusing on key areas of need for older Californians, but also potentially for the network. Work that could be happening through the aging advisory councils, volunteer networks, et cetera, which could also translate into advocacy for new funding in the future, and also advocacy for the interests of consumers too, around really basic needs. And finally, the opportunity to strengthen the AAA Council of California as well, and sort of increase and improve the representation of all AAAs and all counties across the entire state. Next slide, please. So that was in a nutshell the recommendations. And again, I do invite you to read and review the final report, which does go into much greater depth of each recommendation. On the CDA 2030 website, there's also links to the resources and the research. And in terms of next steps, really, CDA is moving forward with planning and implementing certain priority recommendations that I believe Mark will be speaking to in just a second. And then we also, would invite the AAAs and the AAA network and other key stakeholders to incorporate and adopt the relevant recommendations, to be able to point to this document as inspiration, as influence, as motivation, to make changes, to advocate, and to partner effectively to realize this future vision of a future-ready California aging network. And I'll just say in our last slide, if you do have any questions for us and our team, you can contact us directly. We welcome your questions, and we'll be sure to respond. So with that, I want to thank you very much.
Thank you, Jacob. And next, I'm going to introduce Eli Gallardin from the Marin Center for Independent Living. Eli?
Good morning, everyone. It is such an honor and a privilege to be talking about the 2030 strategic plan, and to really talk about what makes a future-ready California. As a disabled professional, as a director of an independent living center, as a longtime participant in the disability rights movement, I really want to call out the grounding that California 2030 has done in moving inclusion and equity, as well as prioritizing access. We in the disability rights community, we as independent living centers, as peer-led advocates and service providers, have always found that the peer lens, whether you're transitioning out of a skilled nursing facility, providing case management and options planning, or supporting someone in sustaining their independence during a disaster, is critical to this work. We are heartened that aging and disability resource connections are prominently addressed and prioritized in California 2030. We are also heartened that 2030 really takes an intergenerational lens to expanding the aging network, recognizing that disability is a part of the human condition, that we age into disability, but we also age with disability. And that in order to create a future-ready California, we really need to have a more integrated and coordinated system. And that means spotlighting and elevating the work of aging and disability resource connections. That means moving more deeply into partnership with healthcare providers, whether it's around CalAIM, Medicaid administrative claiming, or other opportunities to build out our critical work in partnership. Recognizing that we, as a broad aging and disability network, are complicated. We have different models of services. We have different models of advocacy. But to be a better and more robust California, we have to be more integrated. We have to lean into data sharing. And we have to lean into the person and prioritize the individual at the heart of our work. I also really want to point out the importance of leading with accessibility. The truth that, you know, how we provide our services, how we communicate, how we lean into this work has to come from a place of equal access. And that means really tackling the systemic issues around ableism and ageism and its intersections with racism. That means doing our work differently. And that means listening. I was heartened that throughout the strategic planning process, disability was prioritized in the conversation, and that we as a disability network need to elevate and raise our work as we talk about what aging in California means. Finally, I just want to acknowledge that this is a process. This is a first step. And to lean into this work, it's going to take courage. It's going to take doing things differently. It's going to take leaning into conversations that are difficult sometimes. How do we talk about our multiple identities? How do we provide services in a more accessible way if they're not currently centered on accessibility? How do we listen to our younger individuals with disabilities, our youth? How do we listen to our adults with disabilities? And how do we listen to those aging into disability? I believe the leadership of CDA and all of my colleagues who contributed to the steering committee elevated these conversations. And I look forward, as we talk about implementation of California 2030, that we continue to hold those values true and that we do this work collectively and with a little disabled and aging joy. Thank you.
Thank you, Eli. That was great. And next, we're going to hear from Justin Garrett, a senior legislative representative with the California State Association of Counties. Justin.
Thanks, Nelson. Good morning, everyone. Really appreciate the opportunity to speak on today's webinar, and I'm just thankful for the involvement of counties throughout this process. So CSAC was also represented on the steering committee by Mariposa County Supervisor Rosemary Smallcomb, and just appreciate both the county perspective being involved, but also the county supervisor perspective. You know, certainly many supervisors are directly involved with AAA governing boards, but then they also, of course, have governance decisions for the whole county. And so bring that important perspective of knowing how decisions across all the different areas, you know, transportation, housing, land use, you know, really can impact the work of the aging network and the disability network and support and work together. So, you know, just thankful for the inclusion. You know, as you all are familiar with, counties play a really critical role within the aging network, but it's a diverse role, and it varies throughout the state. You know, with 58 counties and 33 AAAs, you know, you have significant variation. You have single county AAAs, you have multi-county AAAs, you have counties that directly administer the services and others that work with nonprofits as the administrators. So there's a lot of variation throughout the state. And this diversity of perspectives was really reflected throughout this process. As was, you know, just covered, there's a whole host of recommendations that present many exciting opportunities for the aging network, and counties stand ready to partner and continue this work. looking at things like funding levels and service availability and delivery, AAA designation, performance metrics, workforce, all of these critical recommendations really directly impact the work that counties and partners in the state do within the aging network. And so that's really critical. We're excited about the opportunities. There's also the really important focus on integration with everything else that's done, and counties play a key role in that as well, with many of the programs directly administered by human services departments such as IHSS or APS to behavioral health and healthcare. Disaster response, counties are really integrated throughout, and appreciate that this report and these recommendations really focus on that as a way to strengthen the work of the aging network as it prepares for 2030. So CSAC, stands ready to continue to partner on this work, both as a administrator of services, but then also as an advocacy partner for what we need to see at the state and the federal level to realize these recommendations. And so again, thank you for the opportunity to say a few words today, and looking forward to continuing the great work.
Great, thank you, Justin. Next, we're going to hear from Carol Swartzlander, the California Commission on Aging Director.
Hi, everyone. I also want to thank you for the opportunity to make a few comments about the 2030 report and the process. First, I want to thank Susan, the CDA team, and Collaborative Consulting for utilizing such a meaningful collaborative process that was centered on diverse consumers, as described by Victoria and Jacob. The Commission on Aging is established in state statute to serve as the principal advocate for older Californians. So both Commissioner Rita Saenz and I were truly honored to serve on the steering committee with the other wonderful members. The approach to this project reflects the responsiveness of the Newsom administration to advocates and consumers. It's a continuation of a tremendous level of stakeholder engagement, listening and being responsive, initiated with the development of the Master Plan on Aging that continues today. Collaborative Consulting did such an amazing job. You managed to distill a lot of information and data into one easy to digest report that offers excellent recommendations. As the report indicates, and Marco stated earlier, we can no longer afford to operate in our own silos. We need to recognize the interdependence, cross-sector, cross-agency, cross-population, policy and program development that's necessary for a future-ready California aging network. I'd like to briefly lift up one recommendation that can be fully implemented at no cost and implemented immediately, and that is 9.6, which is to ensure all AAAs and counties served are represented on and actively participating in the AAA Council of California, also known as TAC. TAC is staffed by the Commission team and represents the 33 Area Agencies on Aging Advisory Council and promotes communication and collaboration among the local councils. TAC members are knowledgeable and dedicated and passionate advocates and serve as the Commission's connection to local communities. However, only 24 of the 33 AAA advisory councils are currently represented. If your advisory council doesn't have a representative, I hope you will encourage your AAA director to appoint one. And finally, I want to share that the Commission also looks forward to continued collaboration and partnership with the Department of Aging, the administration, and the stakeholder community to achieve an age and disability friendly state where all Californians can live with dignity and respect in the setting of their choice. Because as the 2030 report concludes, millions of Californians are counting on it. Thank you.
Great, thanks, Carol. And last, we're going to hear from Mark Beckley, CDA's Chief Deputy Director, and he's going to provide next steps. Mark?
Great, thank you so much, Nelson, and good morning, everyone. So Jacob did a tremendous job of walking you through the 59 recommendations in the CA2030 report, and our speakers did a phenomenal job of really talking about how we intentionally centered our discussions around issues of equity, ensuring that they're founded in serving diverse, historically underserved populations with a true person-centered lens. Very important work that the steering committee did, and so grateful for our partners at Collaborative Consulting for guiding us along the way and ensuring that we accomplished our report by our goal deadline of this past December. So the question is, what are the next steps in the process? So what we're doing right now at CDA is internally looking at the prioritization and sequencing of all these several recommendations. Right now, we're thinking that we'll be looking at areas such as governance, PSA boundaries, and designation criteria, because those are foundational items that the other recommendations we think will naturally flow from, areas such as budget, communications, strategy, and advocacy. Once we have really established the prioritization and sequencing of these items, we're then going to move into building out implementation plans. So really determining, what and how it will take us to actually implement these several recommendations. Again, we're very grateful that we have our partners at Collaborative to continue to assist us with this stage of the process. Once we have developed out some proposed implementation plans, we'll then be inviting our AAA and other aging stakeholder partners to help us further build out and refine these recommendations. We think that some of these recommendations might be easier to implement, those that can be done administratively within existing resources. And then there's some that may require regulatory or statutory packages. And if that's the case, then we'll move forward to start building out the appropriate vehicles to continue to build out the plans. We will be convening stakeholder discussions like the one today as we move forward to implement the different components of CA 2030, and always welcome your input into the process. And just in closing, I just want to thank, again, all of our steering committee members, our partners at Collaborative Consulting, and others who really helped inform the CA 2030 recommendations. It was a long road, but a lot of great work was developed, and I think we've got the right recommendations to really build out a strong aging network and an aging and disability system that really serves everyone. So with that, and I also want to thank all of our wonderful speakers today. Thank you so much, Justin, Carol, Eli, and Victoria for presenting the various perspectives of the steering committee. So with that, I will move into the Q&A portion. So Nelson.
Great, thanks, Mark. I'm also going to invite Jacob back for Q&A. And so some housekeeping for Q&A today. I want to let you know the questions that were submitted in the Q&A box won't be answered live, but responses will be shared in a document and posted to the website in the coming days. To ask your question or make a comment, please select the raise hand icon on your toolbar. And if you're calling in by phone, press *9, you'll be added to the queue. Again, if you want to ask a question, press the raise hand icon. We'll give it a few minutes. We have Rosemarie. I'm going to open your line.
Okay, can you hear me now?
Yes, we can.
Okay, great, thank you. My question is there a plan to, I guess, educate the county commissions on aging so that they can be part of the conversation as you move forward with discussions regarding implementation of the CA 2030 plan?
Would you like me to take that one, Jacob?
Sure. That'd be
Okay.
great.
Thank you, Rosemarie, for your question and for your service on the steering committee. This is the beginning of an educational process, and by design, members of the steering committee were selected because of their representation of larger organizations. So we're really looking forward to partnering with CSAC and the County Welfare Directors Association, as well as the Commission on Aging and TAC, to bring this information that was just shared with all of you to make it more digestible to different audiences. We welcome invitations if there's a small group, but initially we'll be working through large organizations to disseminate this information happy to expand on that if that didn't answer your question.
No, that's great. Thank you, Susan.
Great, thank you. Looks like we have Lee's next, and I want to mention that there will be a 2-minute limit for each public comment. Just keep that in mind as we go through this. Next, Lee.
Thank you. Are you hearing me? Yes, great. Hi, it's Lee Pullen, Marin AAA Director. I just want to thank all of you. This is tremendous work. I just feel so bolstered in my role to see all of this happening and to just see such a clear future and energy around going toward that future. And sorry if I missed it, if it was explained in the last hour and a half, but I'm also looking at the 3rd annual report for the MPA and wondering how the two work together, our sort of network stuff around 2030 and just all the many objectives that are in the MPA. And I don't know if that's a Mark, Susan question or even a Jacob. So thank you.
I'm happy to take that one. Lee, good to hear from you. And I like that word bolstered. I feel the same way. So in terms of the nexus with the master plan for aging right now, and we'll share it in the chat, we are in halfway through a two-year window of master plan for aging initiatives. This conversation is one of those initiatives. And as Mark Beckley said, we're pleased that we concluded the work in December on track and that we're able to use the bulk of this year to move into action and implementation. So it's absolutely part of the master plan for aging. We're now starting year 4 of our state's 10-year blueprint. The master plan for aging takes us over a decade. And so we're moving more into the systems change work, and this is absolutely part of that system change. So whether we're talking about the no wrong door governance, the home and community-based services gap analysis, California 2030 or CalAIM, these are all system change efforts. And this is absolutely part of our current priorities in the master plan for aging. And I would imagine as we start to shape our next round of initiatives that will be finalized this fall and launched next January, that you will see even more specificity in the next round of initiatives pulled directly from this report and this research.
Excellent. Thank you so much for helping me connect everything.
Thank you for your question, Lee. Next, we're going to move to Connie Arnold.
Good morning, and thank you for your efforts to move us in the right direction forwards on Aging 2030. And I would like to ask you, what are the area agency on agings in the state doing to bring participants with severe impairments into the dialogue of the creation of changes that are needed that impacts those that are aging with disabilities? What are you doing for outreach, getting members onto committees that may be quadriplegics, functional quadriplegics, people with complex chronic conditions? How are you outreaching, and are you getting members from local communities to be on those boards so those voices don't go unrepresented? Thank you so much.
Bonnie, thank you so much for joining today and for your comments in the Q&A that will be part of the record of this meeting. There are many ways. So with the county commissions, there are 58 of them, so I can't speak authoritatively about the composition in every county. The AAA commissions, we now have also the local aging and disability planning grants that are part of the master plan for aging. And then we have a number of stakeholder advisory committees, most notably the DACLAC, the Disability and Aging Community Living Advisory Committee, the Elder and Disability Justice Coordinating Council, where we continually update our membership So we were always open to suggestions of new members, and to your point, absolutely, we want to be inclusive of individuals with disabilities as participants. We're on all of our committees, and we're thrilled that we now have opportunities, with Zoom to increase participation from all parts of our state and from people with lived experience. So we'd love to work with you, Connie, for you to be a member or for you to suggest others, or when we do have vacancies and openings on any of our committees, to make sure that you get that word and you can help us to promote that.
Thank you.
I just want to also add, as a response to your question, Connie, there are some areas within the recommendations in the California 2030 that would encourage that sort of greater levels of engagement at the community level. So, things like 1.2, aging services stakeholders, calling for, agencies to bring in maybe more disability voices and voices of organizations into their local area planning efforts, the development of an equity framework, or at either the local or state level, greater engagement with marginalized communities. So I think it's sort of one maybe step removed from what you're talking about, but it encourages sort of greater and deeper engagement with those critical communities.
Thank you so much.
Okay, we're going to move on to Maggie Kraft. Your line's open.
Hi there. Thank you for this opportunity and for all the work that was done. It's been very thoughtful, and we do need a more cohesive service system across the state and standards. I know this will require a high level of an increase or shifting in resources, increase in resources or a huge shifting in resources. And obviously shifting resources from one area to another is not a great idea, because we all need what we have. But I guess my question, Mark, you mentioned prioritizing around governance, PSA boundaries, and I think the third thing you said was designation, maybe, but I lost it. How is this going to be done? How do you plan to implement this in terms of our involvement, area agency involvement? It sounded like you were going to do some work, and then we were going to be invited to help build out those activities. And what is the how do you see a timeline for this priority, also given that we probably won't be seeing a lot of new funding in the next couple of years with the budget outlook? So I guess I agree. We need to improve the system. We need to look at all these elements, and I see a lot of things that could end up in our area plan this next year, potentially in terms of activities we're already doing. But the broader, bigger picture of the idea of looking at boundaries and designation, I understand that that's a step to start with. But could you give us a little more information about how that process will roll out and what your timeline and framework is for that, please?
Sure, absolutely. I'd be happy to, Maggie, and thank you for your question. So we're thinking that within the next 3 to 4 months, we'll really start developing some plans. And I should say it's more like options. It's usually easier when you start with straw man models and then kind of tinker with those and build out those rather than convening a work group and trying to build something up completely from scratch. So we're hoping that by summertime, we would be in a position to start engagement with the AAAs around some of our thinking and some of our models. And keep in mind, some of these are going to be pretty significant. So we're envisioning that likely there would be some level of regulatory or statutory change that would be required. And if that's the case, those have their own timelines to put together reg packages or try to secure legislation. So on those probably have longer tails to them. In the meantime, we'll definitely keep looking at those recommendation areas that maybe we could get some alignment on, maybe aren't as impacted by some of these larger issues that we could act on more quickly. So yeah, in terms of rough time frames, we're probably looking at the next 3 to 4 months, just getting ourselves internally aligned, getting some thinking put together, engaging with you by the summertime, and hopefully by the fall we'll have some sort of ideas of what vehicles, and maybe we can start building out those vehicles to push forward those sections of CA 2030. Does that help?
Yes, thank you.
Okay.
Thank you, Maggie. All right, right now there's no one in the queue, so if you want to ask a question or make a comment, press the raise hand icon on the toolbar. We have Tatiana. You'll be up next. And if you're calling in by phone, press *9 and you'll raise your hand and we can get to you. All right, Tatiana, I'm going to open your line right now.
All right, there we go. All right. Hi, thank you. It's been a very informative presentation, and I'm an information junkie. And when it comes to information sharing and educating the community, I also am cognizant of the fact that many older adults and people with disabilities deal with paper more than they do with online resources. So this is just a suggestion that there be a simple to read brochure that provides the community with an update on this California 2030, so that at the Area Agency on Aging and all of the sub programs that they have, I particularly am interested in the HICAP, have something to disseminate when we go to health fairs, when we do outreach. So that's a suggestion. Thank you.
Thank you. Next, we have Debbie Toth. Debbie?
Hi there, can you hear me?
Yes, we can.
Yay! Oh my gosh, it took me over 45 minutes of trying to get into this. My phone has decided that it does not want me to access Zoom. So hallelujah. I apologize. I missed obviously the bulk of this, and I am hoping I see that it's recorded so it'll be posted so I can watch it. But my first is to respond to Tatiana and say I am just coming out of a local master plan for aging playbook meeting in Solano County, and one of the women there said exactly that. She said, stop telling me to go online, hand me a piece of paper. So I just want to lift up what Tatiana said, because yes, I just heard that live. But I also have a more broad question that you may have already addressed, and so please forgive me. It wasn't for lack of trying that I wasn't here, but how are we as a master plan initiative, when I look at not the 5 bold goals, but actually sort of the goal of the entire master plan for aging, which, is to help people be able to live in the community with the support that they need to live in their setting of choice. And I wonder what the master plan is doing overall to bias our investments to the community rather than to institutions and healthcare. Is there an overarching kind of goal where we address that systemically? And my apologies again if you'd already addressed that.
I can take hi, Debbie, this is Susan DeMorris. I can take a stab at that. What I would point to, it's definitely, strengthening our network of long-term services and supports, and our network of home and community-based services is the approach. And I think currently what we point to would be the framework for the long-term services and supports subcommittee, which was a subgroup of the master plan for aging, where there were really 4 components: navigation, access, workforce, and affordability. And I think California 2030 makes progress on all 4 fronts. Most certainly on the navigation and access piece of that, as the first point of contact for many people, fewer people than we want. So that's a big goal, is to have more points of entry into our system. And as we've heard, the 33 area agencies on aging are known. We want them to be known and visible in their communities, and for people to feel very comfortable approaching them for information, assistance, and referral, with many of them offering the Aging and Disability Resource Connection service. Then we look at the access piece, which is, we really need to grow access to home and community-based services, and that's where the Department of Aging is so proud to partner with the Department of Healthcare Services on the Home and Community-Based Services Gap Analysis and Roadmap to really ensure that all 58 counties have services available as alternatives to institutional placement. And then the workforce to support individuals both in the community at home, to the workforce to support people at home, to support people in congregate settings such as adult day healthcare, and in licensed settings such as assisted living and skilled nursing facilities. So developing our workforce across the continuum. And then last, we're embarking on work around long-term services and support affordability, because we know that so many of these programs and services, whether they're in the home or in congregate community settings or in licensed facilities and settings, are inaccessible to people because they're not paid for by either Medicare or Medicaid. So really looking at individuals who fall above the Medicaid eligibility level, and how can they access home care and community-based care and institutional care when it is needed. So that all of those themes are represented in current master plan initiatives, and you'll see more in our next 2 years of initiatives too, as we get greater specificity on all of those 4 domains of LTSS and community living.
Thank you for that
Thank
question,
you.
Debbie. And next, we're going to move to Lisa. Your line is now open.
Thank you. Thanks for this very illuminating meeting today. I'm curious if stakeholders were included in your research who represent the intellectual ongoing development of older adults, as well as the socialization needs for health.
I'm sorry, do you mean consumers themselves or representatives of those consumers, be it advocacy groups, service delivery organizations? And yeah, could you be a little bit more specific?
Thank you. Yes, I am talking about delivery organizations and advocacy groups.
Yeah, so I would direct you to I believe it was actually the first research report of the external stakeholders engagement. We had interviewed many individuals and organizations representing an array of sort of consumer types and populations and interests, not only within sort of social and human services, but also healthcare and behavioral health too. So I can't by name, but I would refer you to that resource and that document. And I believe there's a list of organizations, and there were several organizations in particular that did serve the populations you speak of.
And I'm sorry, can you repeat what that document is called?
I can, yeah. So it's the External Stakeholder Interview Summary. It was published in June.
Okay.
That document is available on the 2030 website, and we also had a webinar featuring that information as well that is available online.
Thank you.
And again, do feel free to reach out to us if you have any follow-up questions. Happy to answer more questions in detail.
Great, thank you. I'll drop the link in the chat for the Stakeholder Engagement Interview Insights report in just a moment.
Thanks.
Moving on, I have Monica Kirkland. Your line's now open.
Okay, hello, can you guys hear me? Okay. All right. Good morning. Hi, my name is Monica Kirkland. I am the State Policy Director for Senior Services Coalition of Alameda County, and I'm learning and growing in the aging services community. But I was looking through this, and I love all this work that's being put into place to move forward with everything concerning the California 2030, this entire report. I just did have a few questions on the funding. I know obviously with the state we're in with the budget now, this is current and this doesn't represent 2030 and when this is going to be played out. But I did have questions about the in the section 2 for funding, when it talks about the base funding to update for 2.1, where it says update the base funding policies and practices, and then the equitable spending per county. I know because of the complexities of all the needs of this, the aging services community, what would that, I guess, look like as far as updating those policies? I'm asking from a policy perspective as all of us are here advocating, would there be more of a, after everything's kind of laid out, a public forum such as this where the bills or policies that we're trying to look for to be on one page and one accord on, we would focus on? Or I guess I'm just trying to, would like to just wonder from a policy perspective, because I think this is absolutely amazing, but just wondering how would we undergird our efforts collectively to help, steer this along in that aspect for the base funding and even for the fundraising development. And I'm not sure if it's too early to ask that, but yeah.
Let me preface, I'll see if Mark and Susan have a direct response on the policy side of things, but just in terms of the framing for this report, these recommendations are sort of, in a way, they're kind of untethered to any specific agenda. So what I'm saying is that these are sort of open-ended recommendations that could happen. They're not prescriptive to things that will or should happen universally. So, what these sort of represent what we heard and learned both from the stakeholders and from our promising practices research. So I wanted to preface that too and emphasize that.
Okay. Awesome. Thank you so much.
Great, thank you, Monica. We have about 5 minutes left in today's webinar. If you'd like to ask a question or make a comment, press the raise hand icon at the bottom of your toolbar. If you're calling in, press *9. A few more moments. Diane, I see your hand. Your line is now open.
Hi, I'm Diana Jimenez. I'm from Monterey County, and recently our AAA conducted focus groups with 80 seniors living in our rural areas in North and South Monterey County. Majority were low income, but we had some that also had multiple sources of income. But common theme for both groups was the need to have a place, a designated place, a senior center to congregate, to meet with friends, to engage in activities, learn about resources. And unfortunately, both in the North and South counties, most of the areas don't have a senior center. And so there's one in North County in the Prunda area, but it's very dilapidated. But yet seniors go because they like the opportunity to congregate with their neighbors, enjoy a meal, but the activities and the socialization was so important to those with a lot of income and those with very minimal income. So I'm wondering, in this research that you did any of that come up at all, like in communities that are low income, don't have senior centers, the need for that so they can come together, we're I guess I know it's important to create communities that everyone can age well, but without having a senior center, most of the seniors we work with don't have money to join like the YMCA or a country club or anything like that. So having local senior centers with, all an array of activities is a disparity that I'm seeing in our county. from our poorer communities compared to our more affluent communities. So I'm wondering if that came up in the survey. And then the other thing, one of the that we struggled with in focus groups, as much as we like to talk about all our wonderful services, they're not going to come to hear about our community services. So we have to have a way to engage them. So like offer food, raffle prizes, you know, and just different kind of swag items that I know CDA does not approve of. But I'm wondering, will there be budget as we do more outreach to do like focus groups to really engage with the community? And we did we did a couple of the focus groups in Spanish so that we can reach also monolingual, limited English speaking communities. But you know, it is hard to do outreach like that when you don't have a budget that allows for things like that, to make it more fun and engaging for people to come out, right? Because again, as much as we'd like to share about all our programs, we got to get people there and entice them in some way and make it fun and entertaining so that we can also get their input. But so those are, I guess, two questions. Did in your survey the need for local senior centers that are accessible with multiple activities come up as a need, as it did in our local focus groups? And second, will CDA change some of the policies to allow us to use some of the funding to do outreach that includes like paying for lunch or if it's in the evening, paying for dinner or snacks and raffle prizes or things like that to entice our seniors to come and participate?
I can speak to the first question from the survey. So in the CASOA survey, there are several questions around sort of social connection and the sort of the livability of communities. I don't recall if there's a specific question around senior centers, but so there is data in there, and there's I guess kind of a variation of individual or self-reported you know, responses to feelings of social connection and the desire for greater social connection. So unfortunately, Diana, I have I think would have to be a wait and see the data. Some of that data is in there. You probably would see some trends around a need and desire for greater social connection, particularly among folks who are living alone. So certain sort of subpopulations or certain demographics in that data. So there is some of that kind of data in CASOA. And so there are some of those sort of themes coming through. I also want to emphasize that some of that does also appear in the recommendations here and there, but you know, because AAAs don't AAAs don't all operate, a lot of them, or they don't operate senior centers. They might have programs and services in senior centers. Some may be affiliated with or may even operate their own senior center activities. But there's also some kind of connection to it. And obviously a lot of the programs might have a secondary sort of social benefit, particularly, you know, the group activities and so forth. So I think that sort of social connection element does come through in the report and in the recommendations here and there. It certainly shows up in some of the research as well. But I'll sort of look to Mark or Susan on the policy.
Yeah, I can answer some of these, since these are more sort of in the budget vein. So I know that we periodically get requests for funding senior centers or repairs to senior centers, and it's challenging because while federal rules do allow some permissibility for certain infrastructure improvements, at the same time it becomes an equity issue. It's very expensive. How do you do that equitably across the state? And typically, you know, in our experience, you'll see these types of building projects done through bond funds, you know, bond acts. I know we've seen that in the state in the past for various programs. So, you know, that's just an idea regarding senior centers. In terms of allowable costs, so you talk about like swag items, that is prohibited. It's not prohibited by CDA. It's actually a state rule that prohibits the purchase of swag. And I believe there's also federal rules that prohibit the purchase of certain what would be considered swag items. When it comes to meals, you know, I think that, you know, I would encourage you to look at, you know, the current flexibilities that you have under the Modernization Act, the OCM funds, we did kind of loosen some nutrition rules around the use of those funds. So maybe take advantage of those flexibilities with your Modernization Act funds. But those are just some thoughts.
Great. Well, thank you, everybody. We are at time. What a great presentation today and great questions. Again, the presentation, transcript, video, and Q&A will be shared in the coming days on the CA2030 webpage, and it will be sent out via email to everyone who registered. So, thank you all for joining us and have a great day.